Severe anemia, iron deficiency anemia in elderly population, anybody with significant change in bowel habits, altered bowel habits, anybody with bleeding which is not explained by piles has to have a colonoscopy. Anemia is one thing which is very common in people who have got cancers in the right half of the beginning half of the first half of the colon. That anemia will be typically what we call as iron deficiency anemia. So let's say 5 ml of blood every day we are losing, every single day for 6 months. That is a lot of blood. So people will become anemic. Ennada we eat normal, we will become anemic. So if you have, especially an elderly person, but number iron deficiency anemia is very common, especially in the younger woman population. Is extreme. People who are in the menstrual age group are very commonly anemic. So everybody doesn't have colon cancer. But if you the same thing, if you have an elderly patient, let's say who's somebody who's 50, 60 plus, who's anemic for the first time, then alarm bells have to ring. They have to be screened for both right half colon cancer and stomach cancer, gastric cancer. So they should really have an endoscope and a colonoscope to be sure that bleeding is not cause of their anemia. Bleeding which we cannot see, not bleeding which we see. Bleeding which we cannot see is the cause of their anemia. So anemia for the right colon. See, this colon cancer is on the left half of the colon, that is second half of the colon. Then patients will complain of change in their bowel habits. I am more constipated of late. Patterns have changed over the last few months. I am increasingly become constipated. When the after X number of hours, you have alternating diarrhea, constipation. We call it altered bowel habits. Typically, what is normal for you would have changed. So you would suddenly come to the doctor and say, "Doc, it is not the same anymore. Last 2-3 months, maybe 6 months, I am just not feeling comfortable. Things have changed." So anybody with significant change in bowel habits, altered bowel habits, should really have a colonoscopy.